in the community, you know, there are centers where the patient is being refused to be treated. And so I had personally patients here in this office who were turned away from other clinics. And so obviously, you know, you have to have some help to do this, and that's why I'm grateful for this program.
Project Access really put it all together and made it simple. And so now when I see a patient who needs care, I just get to take care of them. I mean, it really is a pleasure. It's a chance to do medicine the way maybe we can imagine medicine was 30, 40 years ago. A patient comes to you, they have a problem, you do your best to fix the problem, and all is well. And there's no coding and all these other assorted things that tend to get us down as physicians.
You meet the nicest people through Project Access. Many of them are people that, for instance, need a hernia repaired so that they can go back to construction work. And they're so grateful and appreciative.
I tore my ACL and needed meniscus repair. Really, without this surgery, I wouldn't be able to work. I wouldn't be able to do my job the way I need to be able to do it. I'm starting to get back into work. I can teach. My students are happy to have me back.
They're really good people, and they're trying to get through life, and you know, an adverse health event can really throw any of us. And I think this is an important part of being part of our community, is to be there for each other when that happens.
We became physicians to help. I mean, it sounds quite simple, but I think it's still the bottom line. And if there is a way to help, it would be hard to say that we don't want to be part of the process. And this project helps to move forward with the notion of there's no limit.
My tongue felt a little sore. A specialist, an oral surgeon, and he took a biopsy, and it came back positive for cancer. And he says, well, it's $20,000 for this and $10,000 for that, another $2,000 for this, and you know, you had me at you know, $2,000. You know, I said, I'm broke. And so Dr. Anderson set me up with Project Access, and the ball just started rolling. So I went into surgery and cut about a quarter of my tongue out, and cut my neck from ear to ear. He said that was the best way to do it, and got everything cleaned out. And I am just so very, very grateful, you know, to Project Access and all the volunteers and the people that have helped me. And I'm just almost overwhelmed, you know, by it.
I mean, it's such a cool way of being able to volunteer at home and give back, you know, to the community, and to help with just our healthcare system and the way that our system is until we have some, you know, change in true health reform.
I would say to give it a try. I would say sign up for 1, 2, 3 consults a year and see how the process works, see how it fits within your clinic, and I suspect you'll be signing up for a lot more after that.
I was really sick, high temperatures. My stomach started bloating for no reason. It got to the point where I couldn't work at all. And I had to quit my job. In a period of 9 months, I had spent $93,000 out of my own pocket trying to figure out what was wrong with me. And the pain was just unbearable. My sister said, go to the free clinic. And I'm like, well, they give you basic health care. They can't give you anything beyond that. And she's like, no, they have a new program where they can get you in touch with doctors after them. They gave me a CAT scan and set me up with a hysterectomy. And so halfway through, you know, they sent the stuff down to pathology and it came back it was cancer. But I remember coming out of recovery and I asked my sister, you know, how much of my stuff do I have left? And she says, nothing. Sorry. And we all cried. That was hard to swallow, you know. I had just lost my mom 3 years ago to the same cancer, ovarian cancer. If you're having a bad day and you're starting to get down, think of what you did for me. Keep doing it, because I know there's someone else out there that needs you. If I could thank them and any contributors, whether it's you spend 1 second of your day contributing to Project Access in the free clinic or 1 red cent, it means so much to me, because not only did they save my life, they also restored my faith in humanity. Being sick for so long, I had lost all faith. I had been in and dealt with people where I am just a number. And these people, they care. And no one's making them do this. No one's paying them to do this. They are here at their own free will because they care. And I really thought there wasn't anybody like that left.